Hi, I'm Dr. Yong. August is Gastric Cancer Awareness Month. Gastric cancer, also known as stomach cancer, is a disease in which malignant cancer cells develop from the lining of the stomach. Gastric cancer is the 5th most common cancer worldwide. In Singapore, it is the 7th most common cancer in men and the 9th most common cancer in women. Helicobacter pylori infection is the most well-described risk factor for gastric cancer. Long-term infection of the stomach lining lead to chronic inflammation and ultimately development of cancer cells. Improved living condition has contributed to a reduction in the prevalence of H. pylori infection and a decline in the incidence of gastric cancer over the past decades. Other risk factors for gastric cancer include old age, family history, and previous surgery. In addition, alcohol consumption, smoking, high salt intake, and a diet low in fruits and vegetables has been associated with gastric cancer. Obesity has also been associated with gastric cancer, particularly located in the junction between the stomach and the esophagus. This subtype of gastric cancer has been on the rise in Singapore. 700,000 deaths has been attributed to gastric cancer every year, making it the 4th most lethal cancer worldwide. Unfortunately, early-stage gastric cancer rarely causes symptoms, and for these reasons, most gastric cancer are detected late. Early symptoms of gastric cancer are often non-specific. The common symptoms include poor appetite, indigestion, abdominal pain, weight loss, and bloatedness after meal. In advanced stage, swallowing difficulty and vomiting might occur. Anemia and black color stool may indicate the presence of bleeding tumor. If you or your loved one are experiencing these symptoms, please consult a doctor immediately. Over 1 million cases of gastric cancer are diagnosed yearly worldwide. Stomach cancer is diagnosed with endoscopic examination. The procedure involves inspecting the lining of the stomach with a camera mounted to a flexible tube. Once the tumor has been located, tumor biopsies are taken and sent to the laboratory for further examination. Following the diagnosis of gastric cancer, CT or PET scan, endoscopic ultrasound, laparoscopy may be performed to look at the extent or the stage of the cancer. The 5-year survival for stage 1 gastric cancer is 95%. This is when the cancer is limited to the stomach lining and has not spread to the lymph nodes or distant body parts. In stage 4 cancer, when the cancer cell has spread beyond the lining of the stomach to other distant body parts, the survival dropped to 8.8%. 50 is the age where you should start screening for stomach cancer. Earlier, if you have additional risk factor or you live in a country with high incidence of gastric cancer such as Japan or Korea. Gastric cancer screening can reduce mortality through detection of gastric cancer at this earlier stage. In addition, the detection and treatment of H. pylori infection can lead to reduction in gastric cancer risk. Recently, a non-invasive microRNA blood-based test has been developed to help your doctor estimate your risk of developing gastric cancer. This test will help your doctor decide if you should go for endoscopic screening. Let's do our part to reduce stomach cancer through making healthy choices, including eating right, staying active, and stop smoking. Once again, I'm Dr. Yong, signing off.